Next slide, Mary. So just want to do a couple of housekeeping items. This is being recorded. So if you are not speaking or asking a question actively, can you please make sure that your line is muted so we don't have background noises? And also, if you have any topics that you would like us to cover for these It's Worth the Shots on Wednesday, please do put that into chat so that way we can get some data around that for you. And then also, you know, we do meet every Wednesday, so I guess we're just doing this indefinitely. Next slide. And again, we want to thank everybody for joining us every week. Again, we've been doing these since the beginning of the year, so the fact that we keep having a strong attendance, we really appreciate your guys' effort to sign in every Wednesday and spend this half hour with us. And we also want to thank everybody who's collaborated with us and helped provide content for the presentations that we do each week. Mary, we do have a poll to start off with this week. If I can get you guys to answer this, do you have a full-time dedicated infection preventionist? There are a couple choices to choose from. No, part-time only. Yes, full-time, but works the floor sometimes. Yes, full-time dedicated IP, does not work the floor. And then other, and if you do have other, can you please enter that into chat for us? All right. Looks like most of them do have a dedicated IP and they do not work the floor. So that's good to know. All right, thank you very much. We can go ahead and share the results of that, Mary. All right. Okay, next I'm going to pass it over to Kyla. We had a couple questions from last week's It's Worth a Shot. So she's going to go over some of the new bivalent vaccination questions that were left over from last week. So I'll push it over to you, Kyla.
Thanks, Miranda. Hello, everybody. Hope you're having a good day. So a couple of the questions that came up last week: how long after a staff or resident received their bivalent vaccine is one considered up to date? So immediately after receiving that dose, they are considered up to date. There's no like amount of days or time frame after the vaccine that they would need to wait to be considered in that up to date category. And how long after having COVID-19 should you wait to receive the bivalent vaccine? There is a recommendation from CDC that you may wait 90 days. They don't say that you have to wait 90 days if you were concerned or if you were maybe a very high risk person, you could actually get it sooner, but they do make this recommendation knowing that within that 90 days, you're really well covered with your immunity if you've actually had the disease. Next slide, please. And the next one, if a staff or resident had COVID less than 3 months ago and it has been more than 2 months since their last booster, are they considered up to date? So they are considered up to date for basically an additional 30 days because they've got that 90-day window in which they're well protected. So in this case, they would still be considered up to date when they hit that 90 days. Then that would be the point which they would need to get their bivalent booster in order to be considered up to date. So I hope that is clear. If there's any clarifying questions, definitely throw them in the chat or you can ask them now.
Thanks, Kyla. So Mary just put into the chat for us the evaluation for this webinar. If you could take some time to fill it out either after the webinar or during the webinar, if you're just kind of listening along, we really would appreciate it because that feedback does help guide us in what we're doing. Our first presenter today, next slide, Mary, is Dana Mitchell, and she helps support Alaska and Hawaii with our nursing homes, and she'll be talking about CMS staffing measures and then updates to Care Compare. So go ahead and take it away, Dana.
Thanks. Next slide. So I'll be covering really the staffing updates to Care Compare. I'm sure everybody is probably more interested in the new guidance that came out last week, but we haven't heard anything from CMS. So I think as soon as we hear from them, we'll plug in a session on that. So some of this might be old news, but I wanted to give a super high level overview of what's going on with Care Compare and the staffing metrics. So I think everybody knows this, that, we've had staffing in there in Care Compare, or previously Nursing Home Compare, for over 10 years, which has been the average hours worked for nursing. And they use that in calculating the staffing domain star rating. Recently, that's been payroll-based journal reporting. And then a couple years ago, they added the weekend staffing, and then they put in new thresholds for staffing and increased the weight for how they calculate the star measure for the RN staffing. And I linked the QSOs where that came out in there. Next slide. So as of 2022, they've done some new things with staffing to Care Compare. So in January, they started to add the number of registered nurses and total nursing staff hours per resident per day on weekends, and the total nurse staffing on weekends. They decided that that staffing can sometimes be problematic on weekends. And so they decided to add that in. Then in July, they're adding some turnover measures. I know this feels like being kicked when you're down. And I guess it kind of is, it is what it is. I think nobody is probably experiencing fabulous nurse retention lately, because staffing is an issue everywhere, but this is what they decided to add in July. So they're adding the percent RN turnover in the previous 12 months, same with total nursing staff turnover, a number of administrators that left in the past year, and the total nurse staffing on weekends. Next slide. So this is their handy dandy relation of staffing to overall quality. And so what it's doing is, along the bottom, it's got the continuum of 1 to 5 stars and annual turnover ratings. I don't think that's going to be super surprising to any of us. Next slide. So I keep the 5-star tech guide on my desktop at all times. So in 2022, this is pulled out of that technical users guide. And as of July, only those nursing homes with 5 stars in staffing will get an extra star for their overall rating. And that's going to include those 6 measures, the 3 turnover measures and the 3 staffing level measures derived from PBJ and your census data. It's case mix adjusted. So they're basing it on the distribution of MDS assessments by RUG. More information on that will be in that technical user guide. And they're covering 1/4 of data. Next slide. Here's your weekend measure specs. So this is out of that technical user guide. We described the turnover in slide 8, which is just percentage of nurses and administrators who are turning over. Here's your weekend measure specs. So it's case mix adjusted total nursing hours per resident day for your RN, for your LPN, and for your nurse aide for a quarter, and they average that across all days. They take then your case mix adjusted RN hours per resident day for a quarter, average that across all days. And then they case mix adjust your total nursing hours per resident days for a quarter, averaged across all weekend days. So those are the specs they're using to calculate these weekend measures. Again, there's a lot more detail in that tech guide. This is just our sort of high level overview of how they're taking a look at those staffing specifications. I think it's important to note that extra star that only comes from folks who get a 5-star in staffing. I'll be curious to see what places are having 5 stars in staffing currently. But this is what they're taking. This is what they added here in July. The next slide is again, a link to that technical user guide, to those QSOs, and a couple other reference materials for you about those changes. And that is all for me. So I will turn it over now to Larissa, who is a new account manager for us, who is diving in feet first, head first, everything first. And she's going to talk a little bit about the CMS approved infection control trainings.
All right, Dana, thank you for the very fitting welcome and introduction. And so, as Dana mentioned, I am Larissa. I recently joined Mountain Pacific as the account manager for Wyoming. So we're going to talk a little bit about the 5 approved CMS infection control trainings that were recently provided to us. And so we're going to kind of dive in a little bit into each one of them. And as we know, one of the biggest goals for CMS is to really look at some global set of knowledge and practices for facilities and standards set for infection control. So, and I come from a nursing home background, and as we know, when we look at compliance issues, we can usually go back to training and how sometimes we have some lack of knowledge in some areas. So those platforms can be accessed by any organizations after they choose to enroll. So we can go ahead and move on to the next slide. So here are the 5 CMS approved infection control trainings. There's the Healthcare Academy, HealthStream, Project First Line, the Quality, Safety, and Education Portal, also known as the QSAP, and Relias. So next, we're going to talk about each platform's key points. So if we can move on to the next slide. So let's talk about Healthcare Academy. This platform provides an infection control certificate program, including some COVID-19 guidance. The program was created in partnership with the American Healthcare Association and the National Centers for Assisted Living. The courses provided by Healthcare Academy can be assigned depending on the facility's focus. Outside of infection control, Healthcare Academy also offers many other trainings in the multiple areas of focus. Next slide, please. So next is HealthStream. HealthStream works closely with facilities to build their training library based on the facility's needs and goals also. They provide evidence-based programs to improve quality of care. HealthStream provides courses to long-term care facilities, assisted living facilities, acute care hospitals, home health, hospice, urgent care, medical centers, behavioral health, emergency medical services, and physician groups and clinics. Home health, so they have 3 different areas where an agency, I guess, can sign up for. One of them being the Home Care Pulse, which provides care providers and staff in senior care with over 200 courses for post-acute care, including infection control. And then there's also the ALEA Senior Care Complete, which meets annual training requirements. So this is where you could get some CEUs for some of those trainings, including, of course, the infection control. And then there's a Duke Interdisciplinary Elder Care Certificate for post-acute healthcare professionals. All right, next slide. So now we talk about Project First Line. I know a lot of us have heard about Project First Line. I know Crystal has presented the escape room under the Project First Line, which has been going pretty well. So the Project First Line is actually the CDC's training collaborative for healthcare infection control, where individuals can learn about infection control in healthcare by watching videos. There's some interactive resources available. And the organizations also have the ability to print materials to assist infection control. So those are all found on their website. Some of the trainings focus on learning how to recognize infection risks in healthcare settings, as well as way to protect the patients. The website also offers a training toolkit available to anybody who would like to engage in the training process. So they also offer trainings in Spanish. So good to know. Alrighty, next slide. So now it's the QSAP, again, the Quality Safety and Education Portal. And their website, you go in, you sign up with your email, and then you can sort the courses based on the focus that you're looking at. So there's a drop down where you can choose skilled nursing facilities. And then once you pick, it's a kind of a filter if you think about it that way. Two of the main courses that you should focus on are the CMS targeted COVID-19 training for frontline nursing home staff and the CMS targeted COVID-19 training for nursing home management. The QSAP also offers courses utilized for the surveyors that they go through. So the same type of training they go through as far as COVID-19 surveying. It's also available on the website. So it's a handy tool to have and some good knowledge there. There's also tons of other courses that are offered in different areas. So definitely a site to check. There's also training for nursing home staff regarding COVID-19 in Spanish and infection control. And then if we can move on to the next slide, we can talk about the last training resource, which is Relias. They have an academy and they offer several courses in infection control, some of them being infection control and hygiene, infection control and home health, basic concepts in infection control, essential principles of infection control and cohorting, infection surveillance, which as we learned through our COVID journey, that's definitely a focus point and important. Also infection control for respiratory therapy, some OSHA fundamentals, hand hygiene, transmission-based precaution, antibiotic stewardship, and several other COVID-19 and influenza topics are also included. And so if we can move on to the next slide. So here are some of the websites for all of those 5 training courses. So if you guys, I would highly encourage that you research each one of them in length to see which ones can probably benefit your communities better, your agencies better. And so this, what we talked about, just a kind of a brief summary under each one of those programs. There are tons of trainings that facilities can definitely benefit from. So this is it for the actual trainings, but I want to thank you guys for all the hard work that you guys do every day in and day out. COVID and immunizations and all the things that are involved there have not been an easy road for us, but hang in there, keep doing the great work that you're doing. And then reach out to us, reach out to any one of us in Mount Pacific if we can help in any way. We're, I'm email away or a phone call away if you guys run into any issues. So I kind of want to open up and see if you guys have any questions that we can answer. Trying to look at the...
Yeah, it looks like for once we've managed to finish early instead of running over or squeezing one of our presenters out.
Right.
Anybody have any questions or any comments or feedback about the content or anything we can help you with? Feel free to come off of mute.
I see one comment about the Project First Line. That seems like the doctor in the video seems to be talking to a young child. And this is always one of those areas where when there's information being put out there and there's trainings, trying to figure out which audience they are going to be reaching seems to be one of those hard tasks, because we have individuals who can grasp a much more in depth and more, with more concepts that some others cannot. And so they tend to go in a direction where it is easier for, a younger or less possibly I'm not saying educated, but you know what I'm saying.
Experienced, yeah, less
Yes,
experienced
yes.
staff member. Yeah,
Yeah.
so CMS did gear these towards healthcare workers, the current Project First Line information. The idea was that they could share it with non-healthcare professionals, because some of them are very geared towards healthcare professionals, like talking about PPE and gowning and glove use and, you know, injections and things like that. And some of them are more broad-based about like washing your hands and cleaning work areas and stuff. And so they tried to speak at a level that everyone would understand, but I can definitely see the standpoint to where the conversations within the videos definitely are, I don't want to say dumbed down, but they're definitely at a level where there should be no problem understanding the content. And I do know that they eventually wanted to take those videos and move them into the public realm, where they would create the same project, but instead of being like the first line workers, it would now be geared towards like family caretakers and different community members and things like that. So non-healthcare professionals, but then project the same information to them. So that way they also understand the importance of infection control, maybe not quite as regulated as what we are dealing with.
Perfect. And I also see a question from Ivan regarding the cost for Healthcare Academy and HealthStream. I would encourage you to go into the website. I don't know exactly the actual costs. I know there are costs affiliated with their programs, but I don't know if it depends on what type of organizations or the length of trainings that you are needing for your individual. So I would highly encourage you to reach out to them.
We can also look into that too and try and address at the beginning of next week's meeting for one of our questions from last week. So we'll look into that for you. Generally.
And I think a lot of times it depends on the size of your facility and things like that. So
I know, I think it was one of them, and I don't quote me, but I want to say it was Relias. They had, there's like a $250 entrance fee, but then there's some other costs for each course that you needed. And so, yeah, but we can definitely do some looking.
Hey, this is Jessie. Can you hear me?
Hey, Jessie.
Hey, everybody. I just wanted to add that we completed a Project First Line training today at the Montana Healthcare Convention, and we did the escape room training, and it was so much fun. And it counts as obviously one of those CDC approved training programs, as Larissa mentioned. And if anyone is interested in hearing more about it or receiving the link to access the kind of the package to be able to bring that into your facility to align with Infection Control Week, just reach out to us and we'd certainly email you the link. And firsthand experience, it was fabulous. And it was really designed so that all members of your team, from maybe environmental services, your clinical staff, your maintenance men or women, could all, dietary, they could all participate in the training, and it was fabulous. So anyone interested, we'd be happy to share that link forward, and it's also on our website.
Thanks, Jessie. Next slide, please, Mary. Doesn't look like we have any further questions at this point in time, so we can give you a couple minutes back in your day. So we just want to say thank you again for taking your time to join us. Mary put the evaluation for the presentation in the chat box one more time. So if you didn't catch that at the beginning, we'd really appreciate if you fill that out for us. And then we are really looking forward to you all joining us next week, where the topic is going to revolve around influenza and influenza vaccines and that type of information. So we look forward to seeing you guys next Wednesday on the 5th. Have a great week and a great weekend. Thank you.